Breathing. Most people rarely think about it, but for many people living with chronic obstructive pulmonary disease, breathing is a daily chore, and sometimes it can even be a little scary.
I was cutting down on my social life because of the physical moving that occurred. Walking, meeting someone somewhere, where could I be there the closest? Finally to the point of, if I had to walk any distance or climb any stairs, I was so breathless that my limbs would just shake and I would have to sit down and try to regain my breathing again, and I didn't know how to do that.
Your doctor has talked to you about COPD, or chronic obstructive pulmonary disease. If you haven't heard of COPD, you may be more familiar with the terms chronic bronchitis and emphysema. COPD includes these two conditions. COPD is also sometimes referred to as smoker's cough. 80 to 90% of COPD cases are linked to smoking. Other causes of COPD include exposure to secondhand or side stream smoke, industrial fumes, indoor and outdoor pollution, and a rare genetic condition. COPD is the second leading cause of disability and the fourth leading cause of death in the United States. Nearly 13 million Americans have been diagnosed with COPD, although it is estimated that as many as 24 million have evidence of impaired lung function. This indicates that COPD is underdiagnosed. Many think of COPD as a disease of the elderly, but it also affects younger people, both men and women over the age of 40. COPD leads to a loss of lung function over time. In the early stages, it begins with breathlessness during high-energy activities. In addition to shortness of breath, when people have COPD, they may experience one or more of the following: coughing, mucus or phlegm, wheezing, trouble with physical activities, bad colds or lung infections more than once a year. As symptoms worsen, patients become less and less active and ultimately become breathless, even at rest. This decline can lead to disability. COPD progresses gradually over time. It can be divided into stages: mild, moderate, and severe to very severe. People with mild COPD often feel short of breath after they work hard or do high-energy activities like climbing stairs or dancing. People with moderate COPD feel short of breath more frequently with lower energy activities, such as walking up a hill or vacuuming. Severe patients get short of breath easily during low-energy activities, like walking to the mailbox. Very severe patients are breathless, even at rest. They may need oxygen and may be unable to perform simple daily activities like brushing their teeth. While COPD is not curable, it can be treated. There are many steps you can take to help you breathe better with COPD. As part of your overall treatment plan, your doctor may talk to you about quitting smoking, breathing techniques, exercise, nutrition, and medications. By following these suggestions, you may be able to lessen the impact of COPD. A history of smoking is the most common cause of COPD. If you already have it, smoking makes breathing more difficult. It can also cause your condition to worsen. By quitting, you can slow the progression considerably. If you want to quit, speak with your doctor about available options. Retraining yourself with proper breathing techniques can help you feel better and do more. One of the most useful breathing techniques is diaphragmatic breathing. This technique trains your diaphragm, the strongest breathing muscle, to push more air out of your lungs. Another technique, pursed lip breathing, can help remove air from your lungs as you breathe out. Learning mucus management techniques can help relieve COPD symptoms. Drinking plenty of fluids can keep mucus thinner and easier to cough up. Another way to manage your COPD is by staying active. Staying active helps make day-to-day activities easier to carry out and can improve your overall health as well. Aerobic exercise helps the lungs by making the muscles more efficient at absorbing oxygen from the blood. This means that the lungs do not have to work as hard to supply oxygen. Regular aerobic activity, such as walking or swimming, can be beneficial. This can help decrease shortness of breath and allow you to do more. Work with your healthcare provider or therapist to develop an exercise program that is right for you. You should stop if at any point you have chest pain or tightness, if you feel dizzy or lightheaded or nauseous, if your joints hurt, or if you feel very tired. If you do experience any of these symptoms, make sure you discuss them with your doctor. Your diet and eating habits can also affect your COPD. Proper nutrition is vital for someone with COPD. When you have COPD, your body uses more energy to breathe. A well-balanced diet provides your body with the energy it needs. It also helps you maintain a healthy weight. If you are underweight, your body may not be getting the energy it needs to function with COPD. On the other hand, being overweight can increase shortness of breath. A healthcare provider and dietitian can help you develop an appropriate meal plan for your condition and help determine what your personal goal weight should be. As part of an overall treatment plan, COPD patients can also benefit from medications to help them breathe better. Most physicians will prescribe 2 different types of medications for COPD to control the disease: a rescue inhaler and a maintenance inhaler. Rescue inhalers are used as needed to help patients catch their breath when symptoms suddenly get worse. These medications help patients breathe better quickly, and they last for approximately 4 to 6 hours. One example of a common rescue medication is albuterol. Maintenance inhalers are used every day, even when patients are breathing better. They are taken every day to help maintain control of COPD. Maintenance treatments help patients breathe better for longer. Depending on the medication you receive, each dose lasts from 4 to 24 hours. Patients use maintenance inhalers every day to help them keep breathing better. Rescue and maintenance inhalers are often prescribed together to help maximize the benefits. Talk to your doctor about what's right for you. Many organizations can provide support for patients with COPD, their caregivers, and their loved ones. You can find a list of resources in the DVD case.
I think the main thing we can do for ourselves if we have COPD is to have a good doctor, good learning tools, good resources, good treatment, and keep at what you're doing, keep active, and there's a great life there.